Hi, my name is Dr. Syed and I'm one of the registered medical practitioners at this hospital. Can I confirm your name and age, please? Okay, so 46 years old and name Jane. Okay, Jane, how are you doing today? What made you come to the hospital? Okay, I understand you have been suffering through a lot of things. Uh, so, may I know that you have dizziness and vomiting for the past 2 days? Uh, and you're very worried and physically your physical activities are hampered. I would like to know if there is any position in which your symptoms aggravate. Okay, Miss Jane, I would like to make you understand that what I have understand up till now is that you have suffered from, you are feeling nausea and vomiting after you had a meal at a marriage ceremony, and you suspect that the fish was not up to the mark. Um, okay, let me ask some further questions if you don't mind. Yeah. Do you have any diarrhea associated with it? Did you had any abdominal pain? Okay. Did you had any fever? Okay. Uh, would you allow me to examine you first, if that's okay with you? Okay. Okay, I have examined you, and Ms. James, as per my assessment, I don't feel that you have any food poisoning itself. The reason being that you don't have any diarrhea symptoms and your abdomen is soft, non tender. What I perceive and what clinical findings indicates that you have suffering from something which is different than food poisoning, and it's called BPPV. Have you ever heard about this? No. Okay. BPPV or benign paroxysmal positional vertigo is a type of symptoms which happens and which causes nausea and vomiting sort of symptoms, or what we call vertigo, and it's positional in sense. If you change the position of the head, it increases and relieves with a different position of the head. The reason being that there are some crystals in the inner part of the ear which get dislodged, and if they don't come back to their own position, it gives a symptom of vertigo. How does that sound to you? Yeah, I can understand your concerns, and I know that it looks rather frustrating for you. But rest assured that we are here to take care of you. Um, the treatment of this itself is quite easy by itself, and we need to refer you to physiotherapists which will do a certain maneuvers called apply maneuver, and this will help to move the crystal back into the appropriate position. How does that sound to you? Yeah, of course, I will advise you some medications. I will now advise you antiemetic like chlorpromazine 10 milligram twice a day, and would also refer you to the clinic of the physiotherapist as soon as possible so that he can do the apply maneuver. Rather, you can continue these medications, and after a week, I would like to see you. Yeah, regarding when it will get cleared up and you will get better, let me assure you that this problem is not permanent at all, and it is just a temporary issue. It will get resolved quite effectively after the apply maneuver. You should continue those exercises as physiotherapy department will inform you, and I would like to see you within a 1 week time. For some patients it can take 5 days, 7 days, or some people it will take a couple of weeks to get the results. You can continue the medications of nausea and vomiting, and this will help you in your vertigo as well. Would you advise me to re-explain whatever we have discussed up till now, because we have went through so many things? So, Ms. Jane, you are having symptoms which is named as vertigo, and I'm afraid on clinical examination you are suffering from BPPV, which is basically the tiny crystals of the inner ear become dislodged from one position and does not come back to its original position, and causes an imbalance which consists of dizziness and vomiting sort of symptoms, and they are positional in nature. What I will advise you is that I will refer you to the physiotherapist at this time. They will do apnea maneuver, which will help you to lodge the crystal back to its original position. I will also advise you antiemetic medications, which will help you to relieve your symptoms. The It will take a week to couple of weeks to relieve her symptoms. Do you need any other further help or assistance? Okay, thank you, ma'am. I wish you best of luck and have a speedy recovery.